Good morning, this is Dr. Janjua. I'm a board certified facial plastic surgeon. Today we will demonstrate a chin implant and platysmaplasty in a localized fashion, almost like a submentoplasty. It is very important to recognize the need for a possible chin implant in patients who present with the need for a neck procedure. You have to sometimes bring it to their attention that because of a very small chin, the submental area is looking loose and saggy. Even if you do a platysmaplasty, it might not look as good as if you combine it with a chin implant. And with that in mind, we will videotape today's procedure and demonstrate that. As you can see in this situation, the neck loose skin is not as prominent as the lack of a chin. The patient has a very small chin and it is imperative to augment that. We'll start our procedure first by marking the area with a sizer of the actual implant. In this case, we are using a Flowers mandibular glove chin implant in large size. That is the actual implant, and this is the same implant sizer. The actual implant is silastic in color, so this is large in size, and we can place it on the chin in advance to mark the area so we know exactly where to place it intraoperatively. With the implant in place with the tape, just to keep it exactly in midline, we can mark the boundaries. Can you tighten your neck? Tighten your neck muscles, okay. This is the main area right there. At this point, we are ready to start the procedure, and as you can see, the patient has been marked for the submentoplasty. This is the area of loose skin and the excess activity of platysma muscle. This is our submental incision. This is midline, and this is the marking of our sizer of the actual implant. We will proceed first with incisions, submentoplasty, by dissecting around and stitching together the platysma, and after that make a pocket for the implant and place it in there. At this point, we have finished our platysmaplasty. The platysma has been stitched together with some undermining and removal of some of the fat. After removal of the fat and the platysmaplasty, we created a pocket for the implant. By the exact measurements, it has to be a tight fit so we don't have to worry about mobility of the implant down the road. And as you can see, it fits right into the pocket right here. And now we will introduce it. We have introduced the implant and it's sitting in a very good position at this time. We will secure it with one suture in the midline, and then we can close our wound and we'll be done. Now we have completed our procedure. As you can see, there's an immediate change in the profile with a good projection of the chin, which has then helped straighten the neck profile and improve the angle. So today we are looking at our patient after one day. We did the chin implant yesterday along with the submentoplasty with platysmaplasty. As you can see, the patient's main dressing is off. We still have a tight dressing here with some paper tape and some steri strips. She's very comfortable, she's in no pain, and she had a pretty pleasant experience. She doesn't have a lot of swelling, and we will keep this on to prevent swelling over the next few days, along with giving her a Medrol dose pack. How was your experience yesterday with surgery?
I was very relaxed.
You were very
Calm.
relaxed and calm?
Yeah.
How was the pain?
0.
0. Oh, that's wonderful. Very good. Great.
0.
Great. Thank you. So we'll wait for maybe 4 more days, 3 to 4 more days. So Monday or Tuesday we'll take this whole thing off, take the stitches off, and then you'll get to see the real new you.
Okay.
Okay.